Canada is seeing a sharp rise in COVID-19 cases, and the race is on to get people protected. A rollout of the most up-to-date vaccine is now underway. It's going to higher-risk groups right now in some provinces, but the vaccine should be more widely available across the country in just a matter of weeks. Alison Northcott has our report.
Darlene McRae was eager to book an appointment for her next COVID shot.
This is important. We have a vaccine against that variant. I want it as soon as possible.
Fall vaccination campaigns are getting underway across the country. Quebec and Alberta have just begun their rollout of the latest Health Canada-approved COVID vaccine targeting a newer variant in long-term care and seniors' homes.
We can give flu, COVID, and pneumovax, pneumonia shots too.
It comes amid a rise in COVID cases and concerns around waning immunity.
In Quebec, it's quite problematic. We're estimating about 20 to 30,000 new cases daily. I actually was just on service last week, and we actually had 4 severe COVID cases.
The new vaccine is particularly important for people who are vulnerable, says infectious disease specialist Dr. Don Vin.
So people shouldn't rely on the fact that, well, I've got the older vaccines, I got the original one, or I got the bivalent one, and I don't really need a booster, because it's not boosting what you've been previously immunized against. It's essentially a new vaccine.
In Quebec, COVID cases and hospitalizations have been climbing since August, and other parts of the country have seen increases too, adding urgency to the rollout.
I am really advocating that people get their vaccine doses as soon as they can, and that provinces start making them available as soon as they can, particularly to the highest risk.
We took our foot off the gas. We should have been a little more proactive in getting these vaccines out sooner.
In Alberta, this home for people with dementia has been dealing with an outbreak.
When we get into outbreak, we have to go right back into the masking and the goggles, doing all the PPEs.
Some hospitals and health authorities are adjusting too, bringing back masking mandates they dropped just a few months ago. Alison Northcott, CBC News, Montreal.
Alison, thank you. That starting point to a conversation this morning with Dr. Isaac Bogosh, an infectious diseases specialist. He's in Toronto this morning. Good morning, Dr. Bogosh.
Morning, Heather.
You were listening to Alison's report as I was, and I'm glad because that number that Dr. Vin cited really set me back on my heels, that Quebec is anticipating 20 to 30,000 new cases daily. What is the COVID threat right now?
Well, it's certainly rising. I mean, we saw the trend starting to pick up at the tail end of the summer as we entered the fall. And predictably, we're seeing more cases as we're in the fall season. We know that's going to happen, and we know that's going to happen every year for an indefinite number of years. The key thing here is to be prepared. We know what COVID is. We also know we're going to see influenza soon and RSV soon. We have tools to protect ourselves. We have vaccines, which are extremely helpful, especially in protecting the most vulnerable. We can put on masks in indoor settings. Well, of course, not perfect, but will reduce our risk of getting infections. We can improve the quality of indoor air, which of course is not perfect. We can reduce the spread of infections in indoor settings where the vast majority of these infections are transmitted. We have the tools to combat this. It's time to utilize those tools.
And of course, so many in the population have already had COVID, the majority, so that I know we've talked previously about how that maybe lessens the threat level a little bit. Can you talk in detail specifically about those elements you just mentioned? Firstly, vaccination. Quebec and Alberta have already started their vaccination program. BC ready to go. We'll see this across the country. But again, coming back to the point that Dr. Vin made, we shouldn't view this as a booster. Is that right, Dr. Bogosh?
I think that's semantic. I mean, do we call the influenza shot a booster every year? I mean, we know that the virus is changing as viruses do. We know the vaccine has been modified to be more aligned with the circulating vaccine. But I think if we actually take a step back and look at it from a very pragmatic standpoint, what's the goal here? What do we think the vaccine's actually going to do? Well, here's what it's going to do. It's going to reduce the risk of more severe manifestations of the virus, including hospitalizations and death. And that's going to be the most pronounced in people who are at greatest risk of hospitalization and death. Said another way, people who are at significant risk of hospitalization and death should really be getting this vaccine. That includes older individuals, individuals with underlying medical conditions, people in long-term care or retirement homes. There's Indigenous communities. Public Health Agency of Canada and the National Advisory Committee on Immunizations really laid out the groundwork for the strong recommendation for who should be getting this vaccine. The other thing that it might do, though, is, for a shorter period of time and to not the same extent as early in the pandemic, it will reduce the risk of infection. It will. It's not as robust as it was in the past. It's not as long lasting, but you will get some reduction in risk of infection for a shorter period of time.
And you were reminding Adrian last night on the National, maybe we could do that this morning. The general rule is 6 months either after your last shot or after infection to get this new vaccine.
And that's not a hard and fast rule. Listen, I mean, I think for people who have questions about this, there's obviously wiggle room. Some people have immune compromising states, and perhaps that 6 months should be shorter. So I think, like anything else, if people have questions about what they should do, it's important to speak with a healthcare provider about this.
Okay. On the masking point, interesting, a number of hospitals in southwestern Ontario tomorrow are bringing back masking requirements. We've already seen that in eastern Ontario. We've talked about in British Columbia. This is happening more and more. But beyond the hospital setting, Dr. Bogosh, I was just struck by the number of people as I was doing grocery shopping on the weekend who were wearing masks in the grocery store, reading an article in Bloomberg saying, is it time to mask up again on the subway? And a discussion around that point. It's hard to imagine going back to daily mask mandates, but what is your best guidance at this point?
I completely agree with you that I doubt we're going to see mandates outside of healthcare settings. I really do. But it's very simple at this point. We have, I was going to say 4 years of experience with this pandemic, but we actually have decades and decades, almost centuries of experience before. If you put on a mask, you're going to reduce your risk of getting a respiratory virus. It's as simple as that. Is it perfect? Of course not. Is it helpful? Yes, it is. It reduces your risk in those individual settings. And those settings are predominantly indoor settings. That's where the vast majority of these infections are transmitted.
We've covered this ground before over these past few years, but it's always worthwhile to spend some time and just refresh the guidance and what we should be doing in our daily lives. Thanks, Dr. Bogosh, for doing that again this morning.
My pleasure. Have a great day.
See you next week.